Good evening. I am Danielle Jones, a member of the Technology Committee with the Suburban Houston Fort Bend Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And supporting me tonight is Lena Ellis. We will be providing technical assistance during this webinar. I would like to make everyone aware that currently all participants are in listen-only mode. We will have a Q&A session at the end of the program where you can type your questions in the box or in the comments section of the Facebook stream. I will now turn the meeting over to Ms. Melanin Johnson.
Good evening, everyone. Thank you all for joining us on this evening. And I am getting everything figured out over here for 1 second because I turned things off. So I have to tell you who we are. Okay, here we go. Hello to everyone in attendance and welcome to the Spring Town Hall Virtual Forum for Delta Sigma Theta Sorority Incorporated. For those of you that aren't as familiar with our organization, we are a historically African-American sorority founded by a group of college-educated women dedicated to the public service with an emphasis on programs that assist the African-American community. Our mission today is to address the current impact of our economy, inflation, and the effect that it has relative to mental health, crime, and the increase of fear facing our youth and their future employment. I am proud to announce our partnership with Fort Bend County Behavioral Health Department and the National Alliance of Mental Illness, also referred to as NAMI, for this forum. We hope you will obtain more insight and knowledge as well as helpful resources for yourself or for someone that you may know who is currently struggling in the aforementioned areas. At this time, I will pass it on to Wanda Adams as she will introduce our panel.
Thank you. Thank our distinguished panel for joining us this afternoon. Our first panelist I would like to introduce is Commissioner Grady Prescetch. He's established an impressive record of public service in Fort Bend County. His taking office in Precinct 2 as commissioner in 1990 marked the first time that an African-American has served on the Fort Bend County Commissioner's Court since the 1800s during a Reconstruction period. He is the president of the Texas Organization of Black County Commissioners and is also an active member of various other organizations. Commissioner Prescetch has initiated the development of the Fort Bend County Community Development Department, the Fort Bend County Housing Finance Corporation, the Fort Bend Toll Road Authority, and the Fort Bend County Parks and Recreation Department. Commissioner Prescetch is married to Farrell Johnson Prescetch and has one son, Dustin, and one daughter, Erin. Dr. Diedrich Bollrath is professor of economics at the University of Houston, where he has been since 2005. He has a BA in economics from the University of Michigan and a PhD in economics from Brown University. His research and interests are in growth and development with a focus on structural transformation, agricultural productivity, and urbanization. His most recent book is Fully Grown: Why Stagnant Economy is a Sign of Success on the Slowdown in Growth in the United States. He's also an author of the Growth Economics blog. Dr. Tamara Harris is a licensed professional counselor, supervisor who has been in private practice for over 15 years. She also served as an educator and a mentor for counseling and training. She specializes in helping athletes and nonprofit performers overcome mental blocks and to prevent them from reaching their optimal performance and full potential. Dr. Harris' research interests include self-care among Black women, the impact exercise has on mental health, youth homelessness, destigmatizing mental health among underserved populations in the Black community. Tracy Nolan is the Workforce Development Manager for Workforce Solutions Rosenberg. Throughout her workforce career, spanning the past 15 years, Tracy has worked for workforce investment boards across Kentucky and Texas. Most notably, in 2012, During the height of the recession, Tracy designed and developed job clubs in Eastern Kentucky, a network of 20+ community job clubs stretching across a network of 23 counties in Eastern Kentucky. In her current workforce development assignment, Tracy is the manager of Workforce Solution Rosenberg, your American Job Center in Fort Bend County. Dr. Connie Almeida is a licensed psychologist in the state of Texas and a licensed specialist in the School of Psychology. She received her PhD in psychology from the University of Maryland in 1985, followed by her postdoctorate specialization in developmental disabilities at the University of Massachusetts. Dr. Almeida has provided and managed clinical services to children and adults with mental illness, substance abuse, intellectual and development disabilities over 35 years. Her area expertise and interests include assessment and treatment of children and families with mental illness development disabilities, learning disabilities, and co-current disorders in infants and in toddlers. In October of 2010, Dr. Almeida joined Fort Bend County as the founding director of the Behavioral Health and Services Department. Chief Roderick Garner. He's currently the chief for Precinct 2. After working for 6 months as a state parole officer, Chief Gardner resigned to attend the Texas Department of Public Safety Trooper Law Enforcement Academy in Austin, Texas. In 1984, he began a career as a trooper and promoted to the position of narcotics sergeant, investigator, including covert operation as a joint federal drug task force operative for the DEA. Additionally, Chief Gardner was instrumental in naming of the B.J. Baines Middle School in Siena due to the impact of Billy Baines made in the community as an elementary principal at Blue Ridge Elementary. Ashley Baines is a school counselor who has been in education for over 14 years. Ashley has worked primarily with students in special education. She is a doctoral candidate at Sam Houston State University. Some of Ashley's research interests include increasing resilience in adolescents, destigmatizing mental health among minority populations, and cognitive impact on the immature and the intimate partner violence. Now, I would like to introduce our moderator for this evening. Dr. Figgins is an individual contributor to our managed care organization. She is a contributing author to I Am Speaking, Rewritten Rules of Encouragement to Affirm Women Disruptors. She is an alumni of Prairie View A&M University with a Bachelor of Science degree in psychology and a Master of Arts degree in counseling. Dr. Figgins received her doctorate in business management, specializing in organizational leadership at the University of Phoenix. Dr. Figgins serves as a board member of a nonprofit organization called Family to Family Network. Next, you will hear after me will be our community partner of NAMI. Ms. Angelina Hudson is the newly appointed executive director of NAMI, Greater Houston. Hudson determines to execute strategies and initiative, collaborations, and partnerships to improve services, resources, treatment, care, and recovery outcomes of people with mental illnesses in Greater Houston that encompasses Fort Bend County and Montgomery counties. Hudson has targeted much of her focus in early identification of those facing mental health conditions, removing the barriers to mental health services and support, decriminalizing those living with mental health conditions by encouraging appropriate treatment options and connecting adults disabled by their mental health diagnosis to supportive employment opportunities, cross-training, and entrepreneurial development. Our next speaker is Ms. Angelina Hudson.
Well, good afternoon. My name is Angelina Hudson. I work with NAMI, Greater Houston. And one of the things that we strive for is making sure that families who are impacted by mental health conditions. They may not have a diagnosis yet, but they're certainly dealing with the signs and symptoms relative to a mental health condition. Our goal is to make sure that those individuals and families find the appropriate help and services and supports that are needed. And we do this through peer provided support, peer-led support. All of our programs are peer-led. We are not a clinical or a diagnostic or medical agency. We are families that support other families who are going through similar journeys. You should know that when you find NAMI, you're looking at non-critical, non-judgmental, sincere acceptance, and you can find research-based, evidence-based interventions, protocols, what types of doctors or physicians to turn to. And if there's a barrier for access to services, we also help families get connected in ways that are outside of the traditional, like if they don't have insurance or if there's other barriers, transportation, or just lack of information, we certainly walk the journey with the families in getting those resources secured. I'll go on to share what services particularly that we provide. We provide psychoeducation. We do not charge for any of the services that we provide. We provide education, support groups. We have a warm line. We do outreach presentations, and we meet families sometimes on the saddest days of their lives while they're sitting in the lobbies of freestanding psychiatric hospitals or in general hospital emergency rooms. What we know is that the earlier a family finds the support that they need and the help that's provided through all the other agencies that you see represented on this call, we give that warm pass off. We use our relationships to help families trust and have confidence that they are not alone in this journey. And I can tell you this because I am one of the families that 21 years ago found NAMI. I have children who are diagnosed with mental health conditions and one who's diagnosed with a neurological disorder. And it was a very severe impact on our family at a very early age. And because of this organization, I was able to learn that our family was traumatized. We were impacted by a mental health condition or multiple mental health conditions, and we didn't have the right information on how to support our family's success. And I can tell you 28 years later, still married, we have weathered our storms and our children are now young adults and doing quite well. But this would not have happened had we not understood what our family was facing. Many times the caregiver is going through denial, shock, hope against hope, and they don't know what no one has told them, right? And so many times the family will go to the school or go to the medical community, and they don't know what questions to ask, fearful, not sharing all the information of what's going on at home because they don't understand the consequences of not sharing that information. And there's a lot of stigma, a lot of shame and blame involved. So what NAMI does, we go in and we provide very supportive peer-led classes by other families who have been there. They know what it's like to walk through this journey. They have sat in the same position as the families who enter the room. And there's no fear of backlash or reporting. We are simply families, and we share all of the wisdom that we've learned through the years and the best practices, where the resources are, where the clinicians are located for almost every scenario you can think of. And we share all of this information through our psychoeducation courses that meet once a week for 8 weeks. We provide all our services on Zoom. And we also have a few in-person classes, but our goal is to remove any barrier a family might have to finding those services. The only way we're able to do this for 33 years at no cost to families is through our walk. We have a walk every year. We have a walk coming up on May 21st. But the reason I bring up the walk is not to ask for fundraising. I only bring it up because Sometimes you may know someone. You may have a neighbor, a church member, family at your school, someone that you know in the community that are struggling. Well, I invite you to come to the walk with this family or this individual. Why? Because at our walk, there are advocates, clinicians, doctors, clinicians, law enforcement, all types of dignitaries, family members, parents, loved ones, individuals in recovery. And you can't tell one person from the next. You don't know who's diagnosed, who's in recovery, but one thing is certain, everyone cares. Everyone that shows up at the walk is someone who is advocating and fighting for the services and the support for people or adults and children living with mental health conditions. So I encourage you to come out and share information. Share information with those that you know. You can go to our website, download free fact sheets. You can download information. You can talk to someone on our warm line. You don't have to identify who you are, and just share what's going on. And we will be careful to make sure that you get the support and the help that you need. And it doesn't matter how many times you call or how many times you come to a class or a support group. NAMI walks the journey with all the people that come to us. So reach out and ask for support. That's the main thing. Don't suffer in silence and do not live in quiet desperation. There are people who care. I thank you so much for allowing us to come out and share this evening.
Here in Washington, the Biden administration fully aware of the economic impact of these sanctions here at home. Americans seeing rising gas prices up another 7 cents in just the last 24 hours. And take a look at the numbers tonight. The national average now at $4.30 a gallon, a 60-cent hike in just 1 week. Tonight here, the images that say it all. American families looking for any place they can to save even a little on gas. Here's our chief business and economics correspondent, Rebecca Jarvis now.
Tonight, the powerful images, Americans bumper to bumper. These long lines outside a Costco in Monterey Park, California, where the average price for a gallon of gas is now $5.73. Drivers waiting to save pennies on their gas. And now economists warning those record-breaking prices at the pump will push already high prices on almost everything else even higher.
This has spillover effects at a time when we're adding fuel to an already well-kindled fire on inflation.
Prices from food to rent already up a staggering 7.5% from last year.
I'm trying to find where to cut back, but groceries are high, gas is high, and there's nowhere to run.
Tamicia Calhoun, who's raising 5 kids in Jackson, Mississippi, tells ABC's Nightline it's forcing some tough choices.
I have missed meals so that the kids could eat. I wouldn't tell them, of course, because they'll try to, share their food with me. We have a big family and the price of meat has gone up so much. It's about $100 each time I go to the grocery store.
She's working overtime just to make it work, but bracing for more hikes ahead.
David, the government releases the latest inflation data tomorrow morning, and economists are forecasting prices could rise as much as 8% since last February. Many of those forecasts also expect elevated prices for the rest of this year. David.
I am Dr. Danielle Figgins, and I will be your moderator for this evening. As our panelists begin to dialogue, I want to respectfully remind the panelists to please keep your responses under 2 minutes, as our target of the event is to capture the responses from all the panelists. Tonight, the panelists will discuss inflation and how it can impact mental health, crime, and employment. Media outlets stated prices have spiked a 40-year high. Sales have increased over 7.5% since last year. From meat, poultry, fish, eggs, to used car prices, and even rent, many Americans are struggling with the rise of inflation and continue to struggle to date. Food banks have seen an increase of families in need of their resources. Experts worrying the Russian oil ban from the war of Ukraine, on top of steep inflation, will drive up already high prices. Mental health is impacted as Americans deal with depression, anxiety, and substance abuse just to name a few. Crime is on the rise as people are stealing gas, catalytic converters, and people are robbed who are victims of being followed from leaving their banks. Our youth are also struggling with mental health and crime. While employment is affected with shortage of workers, jobs are available, but starting salaries are too low to make ends meet for many. And for current employees nationwide expecting to receive a raise, employers are tearing how to keep up with salary increases for employees based on the rise of inflation. The news segment we witnessed aired last month, and as the mother of 5 stated, she missed meals in order for her children to eat. As this is disheartening to hear, this is one of many stories. Excuse me, as this is disheartening to hear, this is one of many stories Americans are facing. I want to start with Dr. Volrath, economics professor at the University of Houston. Dr. Volrath, can you describe to our viewers what is inflation and how it can impact our economy? What causes inflation?
Sure. Thanks for having me tonight. I mean, inflation is essentially what you're kind of thinking of. It's when we report it, it's the average increase in the price of a whole basket of goods. So the literal definition of it comes from you can imagine essentially someone from the Bureau of Labor Statistics walks into a Target every month and goes and buys a certain set of things. They buy a sleeve of Diet Coke and a bottle of shampoo and a bag of chips and a pair of pants, and right. And then they tally that up and they go home and they write a check for rent, and they go look at how much cars cost. They check gas prices and they total that up, and they compare it to what that same grocery with that same shopping cart of goods and the rent and everything cost a year ago. And so the report that we just watched was talking about February inflation rate being 7.5%. It was 8.2 in March, meaning March 2021 prices on average were 8.2% higher than they were in March 2021. So that's, I think, the crucial thing, especially for this discussion, when we talk about the measure of inflation, is that is an average across many, many goods and many, many types of goods, which means that it's also in some sense an average across many, many kinds of families and many, many kinds of households. So it's not the case that every single one of us, the money that, the goods and services that we like to buy went up by exactly 8.2% over that year. For some, if you were in the market for a used car and you spent a lot of time driving around buying gas and you had to fix that car and you happen to really dig bacon and a couple other food products, then the inflation you experienced would have been a lot higher than 8.2%. If you kind of calculate out, half of that inflation is essentially just car related stuff: new cars, used cars, gas. Food and energy then costs make up a little more of that. But so there's some families that really suffer and are facing price increases well above 8%. And then there are other families that are facing price increases that are way below that, that maybe own their home, that maybe have been able to work from home and don't need a car as much, that maybe have different dietary habits or something that don't put them in the mark that way. So when we're talking in some sense about the consequences as it spills to mental health, as it spills to people learning to cope with this, as it spills into the employment market, it's worth remembering that the average inflation rate, the thing you see on TV, is really masking a whole range of effects. Some families really feel it, as the woman in the report was saying, and other families are feeling it less. So we have to appreciate in some sense that there's a lot of variation, which means the downsides can be very, very bad for that group of families that are really facing it.
So as we are moving forward within the year, as far as any type of future projections, do you see the costs as far as it will continue to rise, or do you see prices coming down to help Americans, or what are your thoughts?
Yeah, I think what you would expect to see, at least what the broad kind of guess, to be honest, that we've got, given a lot of uncertainty, is that you'll see some prices come back down. Some of these things are being caused by still supply chain shortages. Things like Shanghai right now is essentially shut down. So supplies and parts and imports that come from certain markets are just not available, which drives up the price of certain goods. So those may come down as things relax. The counter is that the situation in Ukraine, the energy market turmoil that creates, leaves us maybe looking continued increases in the price of oil, continued increases in the price of gas. And as I kind of mentioned, that in the last year, that's made up a lot of where this inflation is coming from is really through the car market and gas. So if that kind of continues, then it could potentially look like inflation will stay high through the year. But there are reasons to suspect that it's going to start coming down and that it will kind of alleviate by the end of the year. But if Putin invades someplace else, who knows? Things can be very different. So it's a tough forecast, especially in an environment that has these kind of geopolitical things happening.
Okay. So I want to move on to mental health, because I know as the inflation continues to rise, mental health, it has taken a toll on Americans. And so I want to start with Dr. Harris. Dr. Harris, reflecting on 2 years into the global pandemic, and now an economic crisis resulting from inflation and high gas prices, what are some of the psychological factors that are impacting mental health in general and underserved populations of people right now?
All right, good question. So right now, as we're in this pandemic, it's so unpredictable, right? And so we're seeing higher levels of people with experiencing anxiety and higher levels of stress. We see people that are frustrated and angry as well, just kind of trying to deal with everyday stressors, fearful, worried, because we just don't know. And so we're seeing an increase of that. But also we are seeing people are going undiagnosed and untreated for mental health conditions, which is a big issue that we really need to focus on. And again, it comes back around to having forums like this, having talks like this, but the educational piece of what those symptoms are. And if we're not able to cope with these stressors on an everyday basis, seeking help so we can be able to cope. And that's going to be key.
Okay. And I would also like to chime in, Dr. Almeida, as well as Ms. Baines as well, because both of you all also serve in the field of mental health. And so, Dr. Almeida, I'll start with you. Could you describe some of the services that you offer? Kind of talk about your organization a little bit. I know you are in Fort Bend County, so if you can just share with our viewers, what is your organization, what it entails, and how do you serve the community?
Well, thank you. Well, we are actually very unique because we're actually part of the Fort Bend County government. And we were created in 2010 under the judiciary, so by the Council of Judges. And then actually in 2018 moved under Commissioner's Court. So we're very fortunate that in Fort Bend County, we have the support from Commissioner's Court, from county government for behavioral health services. And so we actually started with a focus on criminal justice. Like, too many people with mental illness in our criminal justice system, they're not identified, they say they're too long, there's a disproportionality in terms of economic status, in terms of race, we know that. So really judges, justice partners, everybody coming together, what can we do about this? So behavioral health services, the department provides core services to the courts. So competency to stand trial, sanity evaluations. I mean, those are basic things that individuals have a right to. And so again, we're very fortunate that we do that, those forensic court-ordered evaluations. Also, we've been very fortunate to leverage other grants and services to how do we fill in the gaps? We have too many people that don't have access to services, either payer source, they're not eligible, criminal histories, so they can't get the support that they need. I mean, we've already talked about the shortage in the workforce. Well, that is more prevalent than ever, and then if you think about the population that we serve, right, that comes to us, which is often Medicaid, uninsured, low insured or they've lost benefits, right? So they end up in criminal justice. They end up coming to county government for help. There's even more of a shortage for of services for those individuals. We serve adults and children. We have a very unique program that actually focuses on young children in CPS, infants and toddlers, because as we talk about this, we all recognize that starting early is really, really important. That's how we're going to break that cradle to prison pipeline, the school to prison pipeline, that intergenerational patterns of abuse, of criminal justice involvement. And we know that so many of those individuals have mental illness. We know that so many have co-occurring disorders. So the co-occurring substance abuse disorder on top of a mental illness, which of course increases their risk of getting involved in our systems. So we work with many, many partners. We also have, if you go to the county website and you look up behavioral health services, you can find out about our services. We actually have a children's mental health seminars next week, May 6th, because it's May Mental Health Month. The first week of May is Children's Mental Health Month. And our focus is, supporting children's mental health and starting early.
Okay, thank you. I kind of want to get Ms. Baines in as well, because she works with children. She is a school counselor for Crosby ISD. And so, Ms. Baines, what are some of the mental health issues that you are seeing among children in school?
Okay, good question. Let me just say it's a pleasure to be here tonight in this space with you all. I think it's worth noting that prior to the pandemic, we were already seeing an increase in mental health issues and mental health concerns, and the work for advocating for additional mental health practitioners had already began prior to the pandemic. And so we were already seeing a well-kindled fire, and now those behaviors and concerns as it relates to mental health issues are now escalating. And I also believe that it's worth noting that this is going to be a prolonged process in terms of getting our students to reacclimate and adapt and interacting with their peers and readjusting. This is not a process that's going to happen overnight, but some of the mental health issues and concerns that have been noted is just an increase in disruptive classroom behaviors. We're also seeing an increase in symptoms related to anxiety and depression, as well as verbal and physical fights. Those things are all up. We're also seeing an increase in self-injurious behaviors amongst all students, amongst all grade levels, which is a huge concern in the educational setting, as well as suicidal ideations are up as well across districts, regions, state, and nation.
Thank you. So I know our main topic is about inflation, and so it does affect mental health. And so crime is another area where it has really just affected everything, kind of like from what we've seen since the end of 2020 to current. So I would like to bring in Chief Garner. Chief Garner, can you discuss how crime has risen in the past year due to the transition of post-pandemic and the rise of inflation?
Yes, I think that from what we've experienced, a lot of the issues come from the undermanning of police departments. Houston Police Department is undermanned. The Fort Bend County Sheriff's Department is undermanned. And so law enforcement is doing a lot of things that are more reactive. So when it comes to the pandemic, and we always say that invention creates crime. So the catalytic converter thefts, they're on the rise like crazy because of the amount of money that these individuals can get from stealing the catalytic converter, taking it to a fence or a shop that will accept stolen property or not ask where the property is coming from, and they can profit from it. They've become more brazen. It seems that it's all tied to a system that I don't want to say it's broken, but it needs an overhaul. When we're dealing with the inflation, of course, it creates a more dire strait for some of these individuals. And so they're more inclined, or whether or not they're more inclined or they just use it as an excuse to be more criminally active. We had a lot of kids that are committing these crimes, and a lot of it started from them being away from school, spending multiple days, weeks at a time away from the classroom. And in a lot of situations where parents weren't able to supervise them because they had to work or they had other things that they had to do. And then these kids are, as we know, the idle mind is the devil's workshop. So they get involved in criminal activity. There's a few answers, I think, that'll be more pervasive. I think, for one, I have to admit, as a chief deputy for the constable's office, our role is starting to evolve more so than what it has in the past. Commissioner Prescetch has been very supportive of reestablishing and looking at the role of the constable's office in assisting with law enforcement and not just the civil aspects of it. These are peace officers. My deputies are driving, marked police units, and they're expected by the public to be able to respond to these issues. Some of the things we have to do is be more vigilant. We have to educate the public. We have to advise the public of what they should do, what they can do. We're never going to, get rid of crime. We can displace it, and that's what we try to teach the neighborhoods.
Okay, and I want to also bring in Commissioner Prestige as well. And so this can be a question where both of you all can dialogue in the topic of crime and with inflation. So Commissioner Prestige, what actions are you taking to fund grants for youth programs in mental health in Fort Bend County?
Well, first of all, I want to say thank you for having me. And addressing your question, there's never enough money. Let's put it out there. It's never enough money. And counties get their funding from property taxes. And property tax situation is very, very controversial situation right now. We're taking a lot of hits from people about the property tax increase, and it's the market value going up. And the legislature has put a cap on our revenue, 3.5% cap. For Fort Bend County, we had 16% growth last year. We can only raise our budget 3.5%. We'd have to actually reduce our tax rate to not exceed that cap. It makes it hard to fund some of these programs. Now, traditionally, what the county has done is do what it does best. Programming is very difficult. That's hard work. Bricks and mortar, we can do that. So we took the thing that we do best and tried to do that. So we don't have so much youth programs, but we partner with entities that do programming, and we provide the facilities. We built three and fourth under construction, Boys and Girls Clubs. And these are wonderful facilities where the county owns the facilities, and the Boys and Girls Club organization, which serves kids 7 to 18, they provide the programming. To the general public, they assume it's just a Boys and Girls Club. They don't understand that the county owns the building, and the county actually pays the Boys and Girls a fee for services to provide, that organization a fee for service to provide the programming. It's a win-win situation. We also try to focus on other public facilities like community centers and parks, athletic fields, and those type of things, and encourage organized activities. That's usually a good thing to get kids involved in organized activities. But it is tough. And I say again, it's never enough money. This county has gone from 225,000 people when I took office to 860,000. And that's almost 4 times the growth in 32 years. It's phenomenal growth. And so we're trying to keep up and still respect the fact that our taxpayers can only take so much before they'll revolt. I want to echo something that Chief Gardner said. Well, he didn't say it, but the spirit of what I see is that, unless you have a safe community, all this other stuff's not going to happen. You got to have a situation where people feel they're safe and that they can go to the store, they can go to work, that their families are going to be protected. And so we need to fund law enforcement at an appropriate level, but it's extremely difficult. We've augmented the county provided services in Fort Bend County, just like Harris County has, with contract deputy programs, where subdivisions, homeowners associations, or municipal utility districts have paid the cost of extra law enforcement services. And without that, we would really definitely be underserved. So with the revenue caps and with the demand for these services to keep a safe environment, we've got a work cut out for us to try to get that done. With respect to mental health programs, we're part of a regional mental health authority, Texana, and we kind of rely on them to provide some services. Dr. Almeida's program is new. We're trying to push her to find money for us because it's kind of hard to fund those things out of the general fund. And she's done an excellent job of first of all, bringing awareness that we have a problem, okay? And understand, Fort Bend County went from a rural, sleepy county a few years ago to it's an urban county now with urban problems and urban concerns. And we're desperately searching for urban solutions to try to better serve our people.
Okay, thank you. I received a question, and the question is going to be for Dr. Volrath. So as the commissioner mentioned that there are a number of struggles in the county with in securing funds for services. Can you explain to our viewers, and I believe you already explained how inflation plays a role into that, but if you just kind of reiterate as far as how it impacts just the crime and mental health and even employment per se.
Well, right. I mean, I think a lot of the panelists have maybe some insights into kind of how directly that plays in, but I can speak to, there's a lot of research within the field of economics that looks more broadly, using data from around the country about kind of the long run impact of facing these kind of, we'll call it economic stresses. It may be inflation, it may be unemployment. All of those kinds of disruptive economic situations create stresses within families that I think the way that, and this would be interested to hear how some of the other panelists feel about it, I think that the way that some social scientists have tried to explain is that essentially it eats up the attention span of the families and households thinking about, how do I pay rent? How do I make this payment? How am I going to afford that food? I think back to the mother in the brief spot we watched. I was thinking, I'm giving up my food. She's, I guarantee you, thinking every day, how do I get the food on the table for my kids so they eat? And what we see in terms of the long run impacts of that is that by eating up that attention on those short run economic uncertain stresses, it takes away the ability to think about, how do I in some sense invest in my family? How do I progress? How do I go out and get those kids the outside services, the extracurricular activities, the experiences that will help them grow and be successful? You have to kind of retreat to, how do I get food on the table? So I think there's a lot of solid evidence that these economic stresses accumulate and aren't just short run impacts, aren't just going to create necessarily increases in crime that we see maybe in the last year or so, or increases in mental health issues in the last year or so, but they can then spill forward in time. And this will be ongoing impacts of this on families and individuals over the coming years. And so unfortunately, that means that we have to think proactively about how are we going to be supportive of the families who have been affected by this down the road. And there's solid research on that occurring. So it's not something we can kind of ignore. I wish I had a really great answer on what those solutions were, but I think a lot of the panelists here are in some sense the people who are positioned to be the solution for that. And then it becomes a question as people were saying, is like, how do we provide those services in an ongoing manner?
Okay. So in your role, Dr. Vorath, in forecasting inflation and whether economists collaborate with state and federal government officials, are you I'm sorry, let me reiterate. Are you collaborating with state and federal government officials to keep them abreast on future projections and possibly like, I guess, developing a plan of how this can be better?
So I'll say, I'll answer in some sense on behalf of economists, as opposed to say myself. So I like, for instance, no one in Austin is calling me to ask what's about to happen in the next couple of months. But yes, yeah, within state governments, I know within county judgeships, at the federal level, there are economists. We're everywhere. We seem to crawl out of holes all the time. Working deliberately to think, what are the projections for this? Those inflation numbers you see are in some sense created by economists working for agencies with the federal government. So we are embedded in that sense of helping different governmental agencies understand what's coming. If you asked me, they could use us more, we have more to say, right? But then it becomes, again, it's a funny kind of thing, like how much information, how many people can you hire to just do projections? But so yes, those numbers are, I believe as a group, economists are helping to interpret and translate those numbers, I think, for people in policymaking positions when they're in some sense asked for. I think there's definitely situations where there are various levels of government that are, again, attention spans are short and may not have the time or the inclination to reach for those resources. But I can at least say I know that within U of H and the people I know in the profession are in some sense always available for that.
All right, thank you. Dr. Almeida, as Dr. Vorath kind of explained with his role, can you also address kind of like just giving some feedback on the mental health side as far as since you are a part of the county, what are you doing to help? Well, not you per se, but your organization is doing to kind of help the community with the inflation, with mental health as it ties to inflation?
Well, again, we provide services to those individuals that cannot get services other places. So we don't charge for our services, and we do a lot of connection to services. So again, filling in the gaps. We work with our partners, the local community mental health center, other providers, but there's so many people, especially those that are coming out of jail or at risk of going into jail, that don't have any benefits. So there's really no payer source. There's no place for them to go. So often we do see those individuals, and at least we are able to connect them. I wanted to talk a little bit because, some of you have heard these terms, social determinants of health, and what we know, things like economic stability, having a safe and a permanent home are major contributors to health. So with this inflation, there's going to be more economical stressors on people, which obviously is going to put more people at risk, again, disproportionately, for poor health outcomes, including poor mental health outcomes. Not only the stress, but again, that instability, the lack of access to healthy food, the lack of access to safe and permanent housing. If you have to, and we know too many families that, for example, have to make choices between, whether they're going to buy groceries for their children or whether they're going to refill their medications. So definitely we're going to see, or we are seeing it. I mean, we have seen it with our population. I think now it's just going to impact more people because, again, the financial hardships and are going to impact a greater number of our population. We're very fortunate in Fort Bend County that, again, we do have those pockets of communities and individuals that are really struggling, and they're going to struggle more.
Have you seen an increase of people in need of your services since the pandemic, and especially now since we are in the season of an inflation?
We have, yes, we have seen an increase in the number of people not necessarily booked into our jail with mental illness, but all that remains steady, and that's a very large population. I mean, we work very closely with our jail and with our law enforcement partners, our crisis intervention team, but we're seeing more of them being identified within our courts. Now, that is actually a good thing. So I can't tell if it's just we're more knowledgeable, so we know what to look for, because again, attorneys need to be able to identify that, and judges. But we are seeing definitely an increase. We're also seeing an increase in the complexity of the cases, and in even that we're getting. So that makes it a lot harder for us to deal with. But yeah, definitely seeing an increase.
Okay. Commissioner Prescetch, I want to pose a question from our sorority, our chapter. So as members of Delta Sigma Theta Sorority Incorporated, we are based on social action to better assist the community in this effort. So how can Deltas work in partnership with local political leaders to implement initiatives in Fort Bend County?
Okay, well, I mentioned earlier that the county tries to do what it does best, and that's actually the bricks and mortar and the facilities. The programming is where we need partnerships. We need to work with groups. The community centers are there and available at a low cost, looking for people who want to run programs. So any initiative you might have, or anybody else in the community, be it scouting, be it the arts, or athletics, or tutorial things, we have facilities available, and they're looking for people to provide programming. And I'm pretty familiar with your chapter. My wife is a member of the chapter, and so I'm got a close-up look at your chapter. I know the kind of things you do, and I appreciate the resurgence of the Divine Nine group in doing things. Everybody is active. Everybody's doing something. I'm really proud of that. We are truly in a position to save some communities and save some families, and we need to do that. We need partnerships with organizations like Suburban Houston Fort Bend chapter of Delta Sigma Theta Sorority Incorporated to work with us, and other organizations too. I'm an Alpha. We have a chapter, and we have a mission similar to that of your organization. And we try to work to bring things. Chief Gardner is a Kappa, and the Kappas are involved in doing things, and so I think that's a great story. That you give me a chance to make a real strong plea to you guys that please seek out the county and the other political subdivisions for partnerships. In Fort Bend County, we've got a lot of communities that have municipal utility districts, and they've been given broad powers to do things. They can hire law enforcement. They can build parks and community centers. Just about everything that a city can do, they can do. And so seek out those type of groups to try to do programming in their facilities. And of course, the schools could always use, auxiliary type groups to assist in their mission. School business is very hard, and anything that you can do in a school that's low performing, or a school that's got some issues to make the outcomes better, it's a good thing.
Thank you. Before I transition to Tracy Nolan, Chief Gardner, I wanted to pose the same question to you as I did with the commissioner, as far as how Deltas can work in partnership with political leaders to implement initiatives. Just want to get perspective.
I believe just what you're doing now, I think this is helpful, it's beneficial. Sometimes you have to address the issues, bring the issues to the table. There are several organizations, there are several departments within the county. And I believe that when faced with the questions that are coming from organizations outside looking in, then we can have a better dialogue. We could have a better lane to travel in to address these issues. Commissioner Prescetch said that we have the facilities and the buildings, and I think that that is a large part of what's needed in order to get some things done, because you have the comfort of several places that, you know, the county will make available for organizations and entities to meet, to conduct their business, tutorials, their assistance of whatever it is they want to do. If you go over to the east end of Fort Bend County and over near Briargate and Briarvilla, you have an unbelievable sports facility that Commissioner Prescetch was instrumental in bringing to that area. And, you know, I know a lot of the coaches out there. I grew up out there. So I know that it's being well used. And I can only imagine what some of these kids would be doing if they didn't have it. There's also, you know, facilities available for tutorials, for different types of outreach to the community, for education on whether it's criminal justice, whether it's financial assistance, money management, all of those things can be done. So, and with the broad array of professionals within Delta Sigma Theta and the Divine Nine in general, we should be able to help facilitate a lot of that.
Thank you. Thank you so much on your thoughts. Okay, I wanted to move on to Tracy Nolan. She is the manager at Workforce Solutions in Rosenberg. And with our topic of inflation, it has affected so many people, especially with employment, as we've seen from the early days of the pandemic, and especially now with the inflation. But I kind of want to talk about our youth. So first, the impact on employment on our youth and adults during the inflation. Has it increased or decreased since we're at the point of inflation right now as far as the impact of employment?
Well, good evening and thank you for having me. And my apologies for all my technical difficulties early on. But yes, of course, post-pandemic, we are seeing unprecedented high unemployment, and not only for adults, but especially with our youth, with our young adults in that 16 to 24 population. I believe the national statistic off the top of my head is about 1 in 5 young adults in that age range are currently unemployed. And we're finding, number one, we're having a difficult finding them, of course, which is the nature of the beast. And then secondly, in attaching ourselves to help support these young adults. And then secondly, we're finding that those that we are serving are coming to us that have more particular barriers or challenges. And why I think this has been a wonderful conversation, and I've heard bits and pieces of it, and I just can relate so much to everything that I'm hearing. I can tell you anecdotally I'm a manager of Workforce Solutions in the Rosenberg and represent all of Fort Bend County. So I'm part of the work that we do with Workforce Solutions is your public workforce system. And we get a lot of federal funding under our Workforce Investment Act, and we get federal and state dollars to put our young adults to work. And so a young adult who meets some of our eligibility requirements we can put them into paid subsidies. And so there's such a mismatch of, I have all the dollars. We have all these public workforce dollars to put young adults into paid work experience opportunities to help them skill up. But yet we can't necessarily either get them qualified or we can't find them. And so those are some of the particular issues we're having at this point in time.
Can you discuss some of the upcoming programs? I know typically Workforce Solutions work with like the city of Houston, for an example, for like summer programs and things of that nature. As summer is approaching, will these programs continue this summer, or are there any additional programs that's available for our
Yeah, absolutely. They do continue. We are gearing up. One particular program that I do want to share is we are getting ready to launch into our summer Earn and Learn program. And this is initiative is very near and dear to my heart, but it is a paid internship program for youth with disabilities. So you can imagine we have so many people who are marginalized right now and who have been shut out of the labor force. You can only imagine young adults with disabilities and how they may have difficulties kind of merging into an employed role or getting an opportunity to get into the workforce. So Workforce Solutions, we are gearing up and we have a particular need. I have a need in Fort Bend County, and I do work closely with Judge George's office and Expose Excellence in Fort Bend, but we have a real need. And I think the solution to much of what we're talking about on the youth side is really with employers. The solution can be solved with employers is if employers can step up and help support, give opportunities for young adults who need that. So in Fort Bend County, we have a real need right now to find young adults who I can get them qualified to receive these paid subsidies. And I need employers in Fort Bend County who want to step up and say, yes, I would agree to mentor a young adult. I'm going to pay all their wages. We're going to put them on our payrolls. It's very employer friendly. And to just say, yes, I have my work site will mentor a young adult, and it's really that easy. And I can put a young adult to work. We can put a young adult to work, and most importantly, put money in their pocket, and they can get real-time, valuable work experience for up to 360 hours. That's not only youth that come under summer Earn and Learn, but also any young adult who has various challenges or barriers, because they oftentimes, of course, need more opportunity.
So in regards to your adult population that you serve, are employers willing to increase wages for potential job candidates? You know, with the inflation, I know a lot of employers, they're kind of tearing with the idea, should they increase the wages due to the inflation? So could you just kind of give your perspective as far as like do you feel if employers are willing to kind of increase those salary wages?
Yes, so well, you know, I can give you a prime example. We do see that, do see that employers are raising their wages. I can tell you that we are running a small pilot right now. Typically with our young adults, we would put them to work under our subsidized employment at $10 an hour under these federal subsidized funds. We were able to increase that to $13 an hour, and it really seemed to make a difference in getting our young adults involved. But on the employer perspective, some yes and some no. You know, it just really depends on what the feasibility is for that particular employer and the company involved.
All right, thank you. And I think I have another question. Let's see here. Give me 1 second. So as you mentioned, you said, I guess kind of the concern that you're not able to find young adults, you're stating, for some of the programs and jobs that's available. How can we assist with that? How can the community assist with that? How can the public, our viewers, assist to solve your problem?
Yes, thank you. Well, you know, we do work, you know, we're very embedded within our community, and we work very closely with many of our community partners. However, the particular, the young adults who do have many barriers and challenges, we really focus these subsidized dollars to put them into paid internships, really focused under the federal regulations. They're really for those who are in foster care, or exiting out of foster care, those who may be involved with the criminal justice system, young adults who may be pregnant or parenting, those who may be homeless, or those who may be academically maybe not achieving to their particular grade level. So if they have one of those particular barriers, we can get them qualified through a lot of paperwork and red tape to pay these subsidies. However, the problem is that oftentimes to get them through this process, this bureaucracy of red tape, we just either have a hard time getting them in to kind of see us or to get into those appointments or to have a follow-up appointment to turn paperwork in. And so it just seems that, you know, when we have a integrated approach and we're working kind of hand in hand with our community partners and we're sort of tag teaming the young adults, or if there's a good mentor involved, those are oftentimes where we have most success. We don't traditionally just see a whole, you know, we don't see this population just walking through our doors here in Fort Bend County.
And currently at this time, are your doors open? Are you available, or is it still by appointment only?
Well, we are open. We have a limited amount of people that we can serve at one time. However, if you do come in, we'll see you pretty quickly. We are primarily we're receiving the majority of our customers still by appointment. We're working more virtually and over the phone, and really moving into, used to be, you could open our doors but it's more appointment related services at this point.
All right, well, thank you so much. I would like to thank everyone. There is one more last thing, and I'm going to kind of open this to everyone, to all of our panelists. So I kind of want to give our call to action. So Delta Sigma Theta is a public service organization of college-educated women. Social action is the heartbeat of the sorority and address the concerns of underserved communities locally and nationally in areas of funding for mental health services and educational resources, just to name a few. What could be our call to action as members of the sorority to assist the communities of Fort Bend County in regards to the topic of today with inflation, with mental health, with employment? So could some of you all share your thoughts, please?
Well, if you don't mind, I will jump in on that. And speaking in regards to youth and the high numbers of unemployment that we have in that 16 to 24 range, I would like to challenge you as career professionals, because I think you heard me say initially that I really believe that we're going to solve this youth-related problem that we have really through employers and employers stepping up, employers who have interest, employers who, I mean, it has to be easy for the employer and they have to have something in it. And when we have programs and services that we can create, I just really would like to challenge you to go back into your own workplace and explore, take a look at, do you have internship related programs? Are you mentoring young adults? Can you establish or set up an internship? Can you become a work site that could take a young adult and mentor that young adult? And I would challenge you to think of it in those terms from my workforce development perspective.
Thank you. Anyone else would like to give their perspective? I would like to hear from each one of our panelists, if you don't mind.
I would like to add that we need to focus on prevention. We need to start early. We need to support families. We need to have maternal paid leave so moms and dads can stay home with their children. We need to have affordable childcare. I mean, we really need to start early. You know, those early, the first 3 years of life are essential to brain development. I mean, we know that. We know that healthy relationships are critical, safe and stable housing are critical. And the research is there. You know, it's really, if you want to have healthy brains and healthy development, your opportunity to do that is early on. So what we can make a difference by what we do and what we don't do early on in development. And I think we can make a positive difference by starting early.
Thank you.
If I could just follow on with what Dr. Almeida said, because kind of from the economic side, I think it's hard to tell your members that you should go, I don't know, come hang out with me and calculate inflation rates. That sounds like not helpful. But to her point about kind of investing in these families and kids early, so to the sense that you can be active and advocate and assist these people. I was mentioning some of the research on these long run impacts. the return on those actions and those interventions, they pay for themselves in the long run. And on the economic side and public policy side, we do a lot of arguing for publicly funded programs like this, because the dollars that are spent now in supporting those families, supporting those kids, giving them stable homes, giving them regular kind of stable economic situations, those dollars save so much down the line in terms of savings on law enforcement, savings on mental health care, savings on general health care, savings on social assistance in the future. So advocating for those early life and those family supportive policies with your legislators, with your administrators, and wherever you are, is really valuable. That's a powerful way to really have a long run impact.
I would like to interject. Oh, thank you. I'm sorry. I didn't mean to interrupt, but I just wanted to jump in and say, the statistics are, 50% of adults living with a chronic mental health condition would have signs and symptoms by age 14. 75% are going to show signs and symptoms by age 24. So in a typical situation, not a post-pandemic or an inflation-ridden society, somewhere between 14 and 24 people would show up with some signs or symptoms in any given year of a mental health condition. But with the situation that we see now, with the issues that COVID brought, the isolation, both of our children not going to school and our seniors who didn't have a way to leave their homes, and then looking at the inflation and even some of the racial trauma that we've seen in our news in the past, in the past year or two, it's just been a lot. And so now people who were under the radar, they never had a history of mental health condition. They don't know or not aware of a mental health problem that is persistent in their families. They don't see any kind of hereditary implication, are now bubbling up, and they're demonstrating that the stress is just overwhelming. And so there are people now dealing with mental health problems that they weren't there a couple of years ago. And the age is all over the place. It's not just teens and seniors, which that's impacted even more so, but it's all ages, all age groups, right? Even our frontline workers who have been overtaxed and overspent. And so, how do we relieve this tension, this pressure point with our increase or uptick in people who are having suicidal ideation, depression, anxiety? Well, University of Colorado did some research, and they said the number one thing, once a person achieves recovery, the number one thing that keeps them there is significant work. So in Harris County, we partner, Tracy, with TWC. Love to do that with you in Fort Bend, because when people have to find another career, another type of way of making a living to survive, to stay in their homes, Connie, to survive, to feed all the children in the house and eat also. Sometimes they have to transition and acquire different job skills. And TWC has that option, especially if they're diagnosed. So I would like to say more of organizations like all of us here represented need to support adults in completing that process. They need support. They got to find a community that's non-judgmental, not critical, and accepting, so that they can find their true North Star, even if it changes in their 20s, 30s, 40s, or 50s.
I'm going to piggyback on what Ms. Hudson said. Wonderful key points there. I would also say, just having forums like this where we're talking, we're having a dialogue. The other thing is also normalizing people's experiences. We all are dealing with something or have dealt with something in this space that we're in. In addition to that, what's happening is the inability to cope or with these everyday stressors are leading to chronic illnesses as well. So the physical part of that, the physical health part of that, and being able to educate people on, what's happening in those intervention or prevention measures and intervention measures in regards to mental health and physical health during these times that we're living in, because both of those are hand in hand in order to cope.
I'll go ahead and let's jump in here since we've heard from the mental health aspect side. I'll leave you guys with three things because Dr. Connie Almeida, Ms. Angelina Hudson, and Dr. Tamira Harris have done a wonderful job of giving a call to action. The first is intervention. Early intervention is going to be paramount for our students. We know research supports that the sooner that we can provide intervention for our students, the more successful that they will be. And there are resources that are available for our students. So if you lack insurance and you don't have that resource that's available to you, a lot of school districts have programs in which we can connect you to. So reach out to your school support team, the school counselors, your teachers. If you have concerns as it relates to your kids, bring those concerns forward so we can get you connected. The second thing is collaboration. Collaborative effort is going to be key. It's going to be vital in shifting the concerns as they relate to mental health issues. And then finally, advocacy. We should and we must continue to advocate for additional funding for mental health for our students and making sure that we get additional mental health practitioners in that can be of support to our students. Thank you.
I want to just add one thing. The problems are plentiful. We've tried to tonight to strike a balance between inflation and mental health. That's a real tough stretch there, but there's a connection there. We can see, and we brought on just an awareness of all the other problems that are abound. Dr. Figgins, your challenge was, what can you do as an organization and to make things better? And I submit that the answer is with your organization, with your numbers. Success in anything is about competency and relationships. Competence and relationships. And you got to strike that balance. I think you've got the competency in a whole lot of subject matters within your organization. You have hundreds of professional women in this organization. And you have the relationships and what you do on a daily basis. I would suggest that you reach out to other like-minded people and develop those relationships to get things done. You're a very powerful force. You've seen that over the last few years. You can make a lot of things happen. And if anybody can help solve the problems that we have right now, or at least make them better, it's competent people developing relationships and trying to make good things happen.
Thank you.
All right. If I can add anything, I think when we're talking about mental health, Fort Bend ISD has a great CTE program. However, it's kind of short as far as what they offer. It would be nice, and I don't know the logistics of how it could be done, but if they could offer maybe professions or training on the level of, for those who do have some issues, whether it's mental or social, maybe if we could bring more of the trades into the CTE programs. They do criminal justice, they do, I believe, like construction engineering, cosmetology, and there's a couple others, but I remember when auto mechanics was a big deal, and there's a few schools that still do it. I don't know that Fort Bend ISD does, but there's some areas, plumbing, there's areas where we can put people to work, but just like doing these internships, they're great. I think they're worth having. The only problem is when it's over, are they better equipped to go out and obtain a position similar to what they were interning as? So maybe if we can actually give them a trade and something they can become certified in, whatever that may be. And I think, like Commissioner Prescetch said, you have the strength and the divine nine of multiple professionals in all walks of life that could probably make that happen.
Thank you. We only have a few minutes left. Thank you all so much. But before we go, I want to go back to Dr. Volrath really quick. You said you wanted to share some research on the long run payoff from certain public programs. We only have a few minutes, so if you're willing to share before we close out.
Yeah, that's me being bad at Zoom. I was just I was sharing an email with Dr. Almeida so that I could shoot her some resources. But as I mentioned, I'm happy to the things I mentioned about the long run kind of payoff of a number of public programs that kind of pay for themselves. If anyone is interested, just please feel free to reach out. I'm happy to kind of pass along those findings and things. They can be really powerful tools as you advocate with various people in the political system for support for those kinds of programs.
All right, thank you so much. And I know we had a question from our viewer, but I apologize, we are running short on time, so please forgive us. I would like to turn it over to Judge Tamicia Glover. She is our committee chair for social action, so I will turn it over to her.
Thank you, Dr. Figgins. So I want to say first, on behalf of Suburban Houston Fort Bend Alumni Chapter, I want to thank our partners, Fort Bend County Behavioral Health and NAMI, for your participation. This is our second annual Spring Forum. I also want to thank our distinguished guests for your presence and your contribution. I believe that this forum has been informative. It's a lot of information that we've tried to communicate to or share and inform the public. But I think that without your presence and your contribution, then we would not have been able to do it. I've got a lot of notes over here. I have a lot of ideas of ways that we can make an impact with our chapter and also in my professional capacity. So Commissioner Prescetch, I might be in your office. Don't be surprised if you hear from me. I do want to take this time to thank the members of the Social Action Committee for your hard work in planning this event tonight, this webinar. This has been several months in the making, and so I appreciate all of your hard work on that. And lastly, I do want to thank our attendees for your interest and your attention tonight. We've provided several resources for you in the chat. I've also included the link to Dr. Volrath's personal website, and it has links to his book, which is Fully Grown, which in this inflation cycle, I don't know that it talks about a stagnant economy, and I think that we're kind of transitioning from that. So, but if you want to get more information from him or reach out to him for that, his link is also in the chat. I hope that these resources are going to be helpful for you all, or that you can share them with someone who is struggling with the impact of inflation on their mental health, on crime. This is already in employment, excuse me, this is already a very trying time for us all. Thank you again, everybody. And with that, I will say good night.
Good night.
All right.
Good night. Thanks, everybody.
Thank you.
Thank you.